the device has produced. So I will use a Word document to for my presentation today. So are you able to see? Arthritis is starting with definition.
Yes, we can see it, but sauti ndio iko chini kidogo.
Sauti yangu iko chini?
Yes, sasa unaongea vizuri.
Well, I cannot shout past that because we're in the same house and
Okay.
someone else is having another meeting. Denzel is having another meeting in the other room, so I cannot shout past that. But let's proceed. Now, arthritis is generally a disease of the bones and of the joints. So, it broadly refers to as an inflammatory disease that actually affect more of the joints and the bones, presenting with pain, inflammation, swelling, stiffness, and deformity. So that all this comes handy in any type of arthritis. And just to be a little bit more detailed in this, that arthritis is a neuro. It's not a neuro, but it's a degenerative joint disease, or a degenerative bone joint disorder. And so this basically means that it primarily brings about, wear and tear. And we were very specific yesterday when we talked about the cartilage, the articular cartilage. That is a very specific part of the joint that actually experience the wear and tear. It's called the articular cartilage. So what happens is that there are several things that causes arthritis today. And of course, I will really engage you a lot in today's class so that I can also hear from you. And so at least I want you guys to mention at least 10 factors and causes of arthritis. But before that, I want us to understand that in this presentation, we will be able to understand the pathophysiology, like the pathology disease. Physiology is the general functioning of the body. So what transpires in the physiological functioning that brings about pathology or that brings about disease? And we were able to understand yesterday that in our bodies we have the joints. We have the joints at the legs, the metatarsals, the phalanges. We have the joints at the knee joints. We have the hip joints. We have every other kind of joints. A joint is formed by a connection between two or more bones. Like a joint is connecting two bones. So at the joint, there is a point of articulation or the point of meeting. So generally, joints are classified either as movable or immovable. For example, the joints at the skull are immovable; they cannot move. But arthritis generally affect the moving joints peke yake, only the moving joints. Save for osteoarthritis, which can also affect other joints. So, between the joints, there is a fluid-filled synovial cavity called synovial fluid. And this cavity is actually filled with this fluid, and this is what brings about movement and generally maintains flexibility. And so, when there's no lubrication, there will be wear and tear or wear and tear. This is the fluid that is able to absorb shock. And this is a fluid that is able to actually lubricate the cartilages, the articular cartilages in a case of arthritis. So without this, there is a risk of you developing arthritis, a reduction of this fluid. There's a risk of you actually experiencing, joint pains and all that. And so what I'm trying to say is that all those who are having arthritis, they have actually compromised either the volume of the synovial fluid or the articular cartilage. And you can see it here visually. That upper, this is the joint actually. And in the joint, we have the cartilage. This is the point of attachment. And sasa hapo katikati kuna the synovial fluid. So what brings pain is that there is no lubricating fluid, or the cartilage is actually the articulating muscles where the cartilages are actually done away with ama zimebaki kidogo. And so there is wear and tear. So many people are suffering from arthritis today, and so many are really looking for help in the hospitals. But unfortunately, help is not in the hospital, because this is a lifestyle condition. The only thing that can reverse a lifestyle condition is a lifestyle change. Many people do not actually cure from arthritis today just because they are not willing to give up the foods and the practices, the general lifestyle that brought about the diseases. So one of my friends, who is a medical missionary, says that his colleague Jay Agnes says that you will not get well when you continue eating and drinking the same way you have been doing, whether or not you seek medical attention. And this actually includes the medical missionary. Today, we'll be able to appreciate that news that will come in handy when dealing with the arthritis. So what are some of the signs and symptoms of arthritis? Let me get some response. I've been able to mention now that someone is. How do you know?
Excuse me, Mwalimu, you are not clear.
Well,
Like me, I'm not getting you.
You are breaking.
Yes, I believe you can now hear me, right? Can you hear me?
Yes.
Okay.
Yes.
Poleni sana, kuna mtu alikuwa ananipigia, so network ikaenda kidogo, but I've declined the call. Now, let's proceed. So I was asking of the signs and symptoms of arthritis, and I've been able to mention them. So can we name them very fast? Can we name them?
Overweight.
Painful swelling.
Painful swelling or inflammation. Thank you.
Overweight, which exerts pressure on the joints.
That is not a sign and a symptom. Yeah.
Oh.
Not everyone who's overweight. Yeah, it's actually, that is just a predisposing factor to arthritis. So when someone is obese or overweight, you're actually exerting a lot of pressure, like you're exerting a lot of weight to the joints than that which the body should be able to carry. So that can actually cause wear and tear of the joints. So thank you so much. Let's proceed. The question number.
And there's also morning stiffness.
Morning stiffness, ama general stiffness. Thank you, Redemptor. Who else?
And also we have
Difficulty in walking or
Yes, Jane. There's difficulty in walking, just maybe because of stiffness or pain or something like that. But generally, there's difficulty in walking or just stretching if it's the muscles and all that. Yes. Let's proceed.
there's also deformity. Sometimes when it attacks, like now the fingers are deformed.
Great. Good. So before natural joint dislocation. That is, I believe that is what you're talking about. Yes. Yes, family.
or swelling on the hands and joints. Painful swellings.
Yeah, there's swelling, yeah, sure. Thank you so much. So whatever you have, you've actually mentioned is right here with us. Body stiffness and pain in the joints, especially during damp weather or during a cold season. Then we also have sharp burning and grinding pain, and this feeling like a toothache, like ni kama umeshika tu mahali, ni kama mtu anakuuma or something like that. And then there's stiffness and pain when moving the joints, and there's also joint swelling. We talked about the inability to use the affected joints. I mean, difficulty in locomotion and fasting, and this may later result to a permanent disability. And so we are starting with the very first type of arthritis, known as osteoarthritis. Osteoarthritis, as we know, is the disease of osteo inamaanisha bones. Of course, arthritis. So this is a degenerative joint disease where primary mechanism involves someone actually experiencing wear and tear of the articular cartilage. Specifically for the articular cartilage. And for osteoarthritis, majorly it's caused by, how should I say, overstrain or mechanical stress to the joints. Number 3, it can be caused by a muscle or a collagen breakdown where the cartilages actually just softens or erodes just with time. And then there can be what? Majorly those ones. And between the age of 40 to around 60 there. But commonly from 60 kuendelea juu ndio watu wana experience osteoarthritis sana. And so symptoms occur mostly on weight-bearing joints. The major weight-bearing joints are the hip joints and the knee joints, as we learned yesterday. The hip joints and the knee joints. Hapa utasikia watu wana complain, wanauma na mgongo, wanauma na the hips and even the joints. And so kuna stages of knee osteoarthritis, where we have at the first stage to be a doubtful stage, then kidogo mtu ana progress to a mild stage. Mild stage ni kama inauma lakini si sana, lakini bado inauma. And then we have a moderate and then a severe stage, which most of the people really after treatment inakuwa very hard in that stage. So when you talk about osteoarthritis, we are actually basically referring to arthritis of the bones, And which bone? Majorly the weight-bearing bones, to be precise. Pamela, you can mute. Nice. Unless you have something to say.
Okay.
Yeah, so there's a general mechanical strength and even aging in this type of arthritis. And we are losing the muscles, the articular cartilage, and also the synovial fluid generally goes down. And one of the major causes of this is both physical and the psychological stress. Of course, you know about stress. Number two is what do we call it? A lot of pressure being exerted in this stress. So let's proceed. Presenting with PowerPoint is quite really word is quite tricky, but we shall proceed either way. The second one, or the second type of arthritis, is called rheumatoid arthritis. Rheumatoid arthritis is just an inflammatory disease where, of course, you know, we actually did talk about rheumatism yesterday. Well, if we did not talk about it, rheumatoid arthritis is an autoimmune inflammatory disease. Autoimmunity inamaanisha the body is actually attacking itself. So there's an autoimmune attack of the body, in the sense that let me just be specific. One of the causes is from the genetic aspect, where someone can be a carrier of this, or there can be well, if someone is a carrier, there must be an environmental trigger, because we say that any genetic condition, it's like you carrying the gun, but there must be a trigger to pull the gun so that it can shoot. Yani, mtu kama ako diabetic today, na amezaa mtoto, of course, mtoto ni carrier, yes, but the child will only develop diabetes depending on the type of lifestyle he or she shall subscribe to. And so this is the same case with rheumatoid arthritis, an autoimmune disease where there's someone can have a genetic or predisposition to the same, but the environmental triggers like smoking, infections, will actually bring about what is called an abnormal immune activation. I think this is very key so that we understand. And I want you to understand this very well, because this is very key in our treatment plan. I have said that rheumatoid arthritis is an autoimmune inflammation or inflammatory disease. And someone can, one of the causes is that someone can have a genetical predisposition for the same. But there must be an environmental trigger, like smoking, like infection, or smoking, infection, or just the foods. I mean, for example, there are arachidonic acid from the meat and all that. This will bring what is called abnormal immune activation. Let me write this in the chat box so that you can capture it. Abnormal immune activation. And today we are not recording the session, so let's, if I say anything that needs to be recorded, just write it down. Abnormal immune activation. This is what happens. Yes, this is what happens. Abnormal immune activation. And so, with time, this person starts now developing, the side effects of all this. But we have what is called autoimmune antibodies. All these are not in my slides. So, well, they are captured in the slides, but kidogo sana. They're what is called autoimmune antibodies. Like, the first one is called RF, rheumatoid factor. Ingine inaitwa nini? CCP, cyclic. I'm forgetting the name. It's called cyclic. Kama nimesahau, nitakumbuka niwaambie. CCP. Just a minute. Inaitwa anti-citrullinated protein antibody. You can be asked, name two antibodies, or rather name two antibodies that forms immune complexes at the joint. Name two autoantibodies that forms immune complexes at the joint. So one of them is this. One of them is this. Anti-citrullinated protein antibody. And the other one is called RF. RF is rheumatoid factor. Rheumatoid factor. Sasa, why am I bringing all these concepts? It's just because of this. One of the causes of rheumatoid arthritis is autoimmune, the autoantibodies, like the rheumatoid factors and CCP. And these autoantibodies forms immune complexes at the joint. They form immune complexes at the joint. Sasa, tukienda hospitali na tunataka kujua kama mtu ako na rheumatoid arthritis, tutapima CCP ama RF. But kuna other anti-inflammatory markers. An example is anti-inflammatory markers. An example is procalcitonin. But don't worry about that. In your infection, infection can also cause arthritis. And so what I'm trying to say is that these are some of the tests that we do to affirm that someone is having rheumatoid arthritis. Sasa RF ya mtu ama rheumatoid factor ya mtu na CCP itakuwa high in a case of rheumatoid arthritis. But in a case of osteoarthritis, it may not be very high. It may just be in the normal ranges, or inaweza kuwa a little bit high. But for osteoarthritis, remember there's a porous bone. Sasa tukifanya MRI ama ultrasound, you're able to see, but MRI actually inaitoa vizuri sana that there's a porous bone, and this can bring about other complications that we like to see. So I have talked about two causes of RF, rheumatoid arthritis. I have talked about genes. I've also talked about rheumatoid, of course, rheumatoid factor and CCP. So let me just proceed a little bit with this. So this formation, I mean, when I talk about this formation, I mean the autoantibodies, RF and CCP, can form actually can form, well, it can actually be able to how can I put this? It can actually be able to form an acid. I mean, this results from acid and purine accumulation from amino acid breakdowns together with decreased calcium supply, especially in the joint. So what happens? There's an acid and purine accumulation at the joints, and also an amino acid breakdown that actually decreases the calcium supply at this region. Let me relate it to our normal, daily lives. So, mwili ikiwa na acid nyingi, if you are hyperacidic, the body is generally hyperacidic, then what will happen is that calcium will be used to neutralize that acid, For example, if you take a lot of acidic food, which literally stays in the stomach for long, then calcium will come from the bones, from any other organ, just to come and neutralize that acid. And this is what brings about bone brittleness, because now we don't have enough calcium. And this is what brings about joint effectiveness or something like that. So this is one of the causes of rheumatoid arthritis. This is one of the causes. Rheumatoid arthritis. So we talk about arthritis, we talk about rheumatoid arthritis. At least from this class, you'll be having just an idea on how these things come about. So a picture on my slide is one of rheumatoid arthritis. Of course, you can see the presentation in chronic arthritis for more than 20 years. And you can see there's inflammation, and this is actually presenting with a lot of pain. And of course, there's joint dislocations, and I will come and you can actually be able to see. Then rheumatoid arthritis in the foot, you can see the presentation. There's some of the things that when you see, you're able to now question in the line of arthritis, such pictures. That kuna joint dislocation. That is why we around that area, and even around this area and around that area. And so the third arthritis is gout. Gout is a metabolic disease which is characterized by extreme pain starting from the toe, from the big toe. The big toe. If you think of it, arthritis. It is a crystal induced. I believe you can still hear me. Someone was actually calling, but cannot pick right now. Are we together? Are we still together? Are we still together? Great. So I was actually talking about gout arthritis. Na nimesema this is just a minute, I get it right. Good. So you can proceed. You can proceed now. So I was saying that this is a crystal-induced arthritis. Majorly, this comes about because it's what is called high uric acid in the blood. There's high accumulation of uric acid in the blood. Inaitwa hyperuricemia, something like that. And so these crystals are actually accumulating the specific part of the toe. Starts at about 35 to 45 years, and mostly it's common in postmenopausal women, and this majorly there's a sudden attack at night and extreme pain and swelling of the joint as someone actually ages, and majorly was there. So this presents with difficulty in motion, sharp pains, sometimes skin itches, and sometimes the skin, majorly the toe, actually peels off after the swelling has subsided. And sometimes it brings about the GIT problems, the gastrointestinal problems and attack. Most commonly is a general pain in the gut. So milk and lots of tomatoes are linked with this disease. Milk, why? Because milk actually milk is ferment in a letter acid, and this is actually accumulating. By the way, if you ask me of sorry for this, yeah, great. If you ask me of accumulation of uric acid, then I will tell you, of course, this is an acid. So majorly, there's an accumulation of this acid over time, and this brings about crystals, and then it brings about recurrent attacks and all that. So what happens is that we need a good number of magnesium, calcium, just to balance the bone health and also the GIT. Without this, there will be actually a sudden attack in the GIT. And so we also have other types of arthritis that comes about. For example, we have septic arthritis, which I did really not include in my menu. But these are some of the symptoms and presentation of gout arthritis. Naona vile watu wamefura miguu, and it's very painful, by the way. It's not a joke. It's very painful. You can see the joint dislocation at this point and all that. And sometimes gout arthritis and septic arthritis, that is arthritis that comes due to infection at the joints, can present at the same time, gout and septic arthritis. And so this is now the orientation where this is the pathology of gout arthritis, where there's formation of what is called urate crystals in the joints of the toe, and also generally this is where it starts from. And so the synovial fluid becomes less active just because of the inflammation and also the uric acid inamaliza. And so this is what is called gout arthritis. And then we have ankylosing spondylitis, any arthritis of the spine, majorly presenting with pain, stiffness, joint fusion, and also just inflammation. And majorly between 20 to 40 years, just because of excess pressure and also excess intake of acidic food. And then we have septic or infection or infectious arthritis, infection arthritis, where the invasion of the joint space by microorganisms, especially bacteria, can actually cause this, so that it will actually affect. Unajua ikiingia pale itakaa in the space of the synovials, fluid. And this will disrupt the pH. This will disrupt the accumulation of that fluid. It will bring about inflammation because generally infections, tumesoma pale nyuma, by the way, that infections brings about inflammation. And so this may bring about inflammation. And once inflammation is there, you expect pain. And this is what brings about septic arthritis. Of course, we have others like reactive arthritis, psoriasis arthritis, juvenile idiopathic arthritis, and arthritis due to systemic infection, which is just closely. Actually, all this is in one way or another attached to the ones we have been able to talk about. And so that is what causes arthritis. And I will proceed by, of course, giving more insight on the causes as we talk about management. Lakini hadi penye tumefika, what 5 major things are we controlling when we want to treat arthritis? What 5 major things? These are questions to the class. What are we managing when treating arthritis? And how can we manage it? Like we are treating from cause to effect, you know. So, what are we managing? And generally, how can we go about the treatment? Let me get some responses. What are we managing? And how, which remedies can we use, or how rather can we treat or manage these symptoms? I'm waiting for responses.
I can try.
Yeah, please. Yeah.
Because we've seen that acid is one of the causes, so we'll be eliminating the acid-forming foods from the patient's diet.
Thank you so much. An example of acid-forming food?
Milk.
Milk.
Red meat.
Red meat.
And carbs.
Yes. Refined carbs. Let's proceed. Thank you so much, Kevin. What else? What else are we supposed to be doing? What else are we supposed to be doing? I think someone is already having arthritis. So how would you go about the treatment? How do you go about the treatment? Actually, sincerely speaking, I expect all the answers from you because we have talked about this in class in one way or another and in other conditions. Now, we're just relating and copy pasting.
Drinking neutral acidity in the body.
Sorry, I didn't get you all. Drinking?
Hydrated the body enough.
Well, very important. Hydrating the body enough because even the synovial fluid comes from water and other components like minerals and foods with the nutrient properties. So thank you so much.
Avoid animal products.
Avoiding animal products, and for you to actually fasten the treatment, just avoid them completely during the time of treatment. What else? What else are we doing? What else are we supposed to do? Sijasikia mkiongelea pain, sijasikia mkiongelea inflammation, sijasikia mkiongelea regenerating the cartilages, sijasikia mkiongelea hydrotherapy. Hizo ndio answers nataka. That's what I need. So let's be specific. How do we manage pain? Just list 4 methods we'll use to manage pain to an arthritic patient. Yes.
Hot water foot bath.
Yes, hot water foot bath, but we will do a contrast bath in this case. But hot water, because they will do a contrast bath with Epsom salt. Yes, that is right.
Poultices?
Yes, so be specific on the poultice that we will do. Sijakupata vizuri.
I'm saying I just know cabbage inafaa kukua hapo.
Wewe bana, umekuwa class kweli? Najua sasa hivi unafaa tuliongelea poultices class sasa. Usiniambia ati cabbage inafaa kwa hapo. If our formulas are not good enough, you should be able to, of course, come up with your formula. So what do we include in the poultices? Let's now be realistic and very specific. Yes, anyone, what do we include in the poultices?
The charcoal.
Charcoal. Why do we use charcoal?
To absorb toxins.
Thank you so much. Hizo ndio majibu sasa nataka. We use activated charcoal poultice just to absorb the toxins and also just, of course, activated charcoal, by the way, pia ina reduce uchungu. So that is right. Tulishasoma vile mtu anaweza tengeneza activated charcoal poultice. So that is right for me. What else need we in managing the pain? We talked about hydrotherapy, where we are doing contrast foot bath, or hot and cold fomentations, and then we have poultices. Now, poultices, we can do activated charcoal, that is a good one, but which other poultices can we do again to manage the pains? Which other poultices can we do?
We said cabbage.
Yes, so cabbage. Yes, cabbage is right. But tunaweza mix cabbage na nini ama tunaweza tumia nini instead of cabbage?
Like olive oil or castor oil.
Castor, olive oil. Okay, well, then proceed. What else? Anything for the inflammation?
Is 21 hours.
You can also what is it?
Well, I didn't get you well. You can come up again, can you?
I'm forgetting the name of this, but it is tomato family. This one is used much in potato. It's called CD. So.
Oh, well, we could have helped you, lakini kuna venye tunakupata kidogo unakatika kidogo, so we cannot be able to join the statements well. But I've heard you talk about cabbage poultice na tuna. You are actually looking for an analgesic, and I'm pleased. Well, anyone who can help us? Sorry, sincerely, we did not get you well. but you can type in the chat box. So we can use turmeric for reducing inflammation. Tunaweza tumia flax seeds also for reducing inflammation. Wacha niwaibie mtihani so that mkue keen. We have agreed that after this class, everyone will come up with their own treatment program for arthritis, and we'll collect it on Sunday. So just note most of these things, what you are saying, and then you'll come up with your own treatment plan. It's a daily program of what can be done by someone having arthritis. And this is specifically, this is for both osteoarthritis and rheumatoid arthritis. Sasa unaandika tu program moja yenye inaweza deal na hizo conditions zote. Now, great. So we've talked about poultices, we've talked about you can also take some capsules and some tablets for pain, kama Mufastil. You can also take other pain relievers, like you can add fennel hapo, uongeze turmeric, uongeze moringa. Hizo zitasaidia for pain kabisa. And so, onto the treatment. Have this in mind, that when you talk about osteoarthritis, this is an arthritis of the bone. And for arthritis of the bone, one of the causes is aging. So, aging brings about the gradual wear and tear of the cartilage. But now, you cannot stop aging, so that uambie mtu, labda uambie Mungu asimamishe jua, ama or something like that. But remember that for aging, you will use a lot of antioxidants for the same. And then we have mechanical stress. Sometimes wengine wana develop arthritis over time because wamekuwa na chronic stress. Now watu by the way, most of the time develop arthritis na wako na ulcer at the same time. Na hypertension, those three. Of course, hypertension mtu akishakuwa nayo kidogo ina graduate anashikwa na diabetes pia. So when you wamekuwa na chronic stress, actually this problem starts multiplying and even becomes more dangerous. So remember that we have stress, and most of the physicians today forget stress in arthritis. And any patient who you are handling, someone who can stress, please help them sort out or solve the stress problem. Kindly, it will work handily in managing the disease, So let's proceed. That was a by the way, but a good by the way. So in my presentation, this is general outline, so that trust in God that alone comes first. Trust in God comes first. Then avoid all mentioned causes of risk factors. The ones hizo zote tumesema zote sana nazo. The short to have all the list of health, that is it. Exercise, nutrition, water, temperance, trust in God, rest, and all that. And then rehydrate. Take plenty of water, strictly about 8 glasses a day. But I had told you how to calculate the amount of water someone needs in a day, so I will not be able to go back into that. And then we'll give anti-inflammatory diet, and this is literally a strict vegan diet with all the foods in it. And these foods must be very rich in vitamin C, vitamin B, B6, zinc, phosphorus, and calcium. Calcium. And then hydrotherapy, very key. There is contrast. We use contrast fermentation, contrast or total food bath. And you can add a pinch of cayenne and also some salt. And then weight control is very key in managing any type of arthritis. So that if the problem is weight, just like a program that will also be able to Yes, to address it. Pamela, can you? Yeah, mute nitaendelea. Yes, have you muted? Okay, nice. You can proceed. You can proceed. Now, let's now dive deep into this. So we talked about activated charcoal pulses over painful area, and this is able to absorb toxins and also just generally be able to to do what? Generally be able to reduce pain. Cabbage poultice, a very good one. Actually, let's add cabbage plus cabbage, naongeze turmeric, naongeze Irish potato, the raw Irish potato. Hizo tatu. Hizo zitamaliza inflammation yote. Naongeze cayenne. Cabbage, turmeric, Irish potato, cayenne. Na kama hauna zote, weka zenye uko nazo. That is very powerful anti-inflammatory, anti-analgesic, anti-arthritic formula. So just do a poultice of that. Then we have hot castor or pack. This is just a hot pack on the affected area, but ukishaweka cayenne si lazima ufanye hot castor or pack. Cayenne will bring about a heating effect. It will increase the temperature around the joint. This will improve the blood flow to the joint, and then this is what will bring about faster healing. Once you improve the blood flow to the joints, you are able to bring faster healing. Then lemon water in the morning. Do you know lemon water is able to increase the pH, like it's able to turn the body from acidic nature to alkaline nature. Na tumesema one of the causes of arthritis is that the body is acidic, uric acid. And so what happens is that you need to alkalize the body. This is why we are prescribing a vegetarian diet. Most vegetarian diets are able to alkalize the body. But for you to even facilitate this process, in the morning, let these people take lemon water. Kwa hiyo lemon water waongeze cayenne kidogo. Na lemon water cayenne wanaweza ongeza black stuff molasses. That is a very powerful starter for the morning. And it's able to stimulate or rather activate the stomach and just alkalize the body. And this will do you wonders. And ginger, wow, ginger is one of the best herbs that I've ever known for inflammation and pain. So, just do a ginger poultice. Ongeza ginger tena cabbage. Ongeza ginger hata na ginger, cabbage, turmeric. Vitu kama hizo tu. And then you can also apply aloe vera gel. Hiyo itamaliza uchungu sana sana. Ita bring about the regeneration of the cells around and in the joint region, Then you have play pack poultices ya kureduce to maumivu. So let's now be specific, because that is a general treatment for almost every arthritis. Lakini we now want to touch on a specific type of arthritis, and we are starting from osteoarthritis. For this, put 10. Actually, I want to do away with this. I want us to have cayenne, and you add a little bit of salt. You add a little bit of salt. Your salt, sitaki kusema ni kiwango gani. But Well, so that is about. I was writing this note when I was in a hurry, so five teaspoons of cayenne, 20 drops of olive oil. Combine the 3 leaves with a glass bottle. So for various days, come a 1 week easy, and then massage the area too. Around 2 minutes for about 20 minutes. Then 2 minutes in a Arthritis dog, and then for about 20 minutes. So these are very powerful massage oil. Lakini, I want to give you another formula, another massage oil formula. So another massage oil formula goes this way. You have olive oil, unaongeza cayenne, and then unaongeza rosemary. You can add eucalyptus oil. You can add rosemary, cayenne, eucalyptus oil. You can add you can actually use shea butter, lakini si lazima. And then you don't mix everything. You just make olive oil na cayenne na rosemary. Zinakaa for about 5 days, about 4 days hapo. And after that, of course, you shake every day. Just every day, you just shake every day. And after that, you can add DMSO. I believe you know what DMSO is. So dimethyl sulfoxide. This is a very good oil that is able to penetrate, and it's able to actually dissolve those oxalates. Si tulisema saa zingine kuna calcium overaccumulation and also uric acid accumulation in the joints. And this is able to actually clear it off. Is able to clear it off the DMSO. So unaongeza hizo vitu zote. DMSO unaweza ongeza baadaye, but unaweza ongeza olive oil, cayenne, rosemary, eucalyptus, and then instead of olive oil you can use acidity. But the oils are the massage oil I came with the other time nilitengeneza na olive oil, na cayenne, na rosemary, na eucalyptus. DMSO sikupata. And then just mix them together. And for that one, I used what did I use? Shea butter. This shea butter. So this was just to crystallize it, but with the olive oil it was sour. It was actually crazy. Are we together? Are we at par? Are we together?
Yes, we are together.
Ni kama nimepoteza watu wengine because you guys are not speaking. Any question thus far? Because I feel like I still have a lot to cover, but I think we'll just extend it about 10 minutes na tutakuwa tumemaliza kila kitu. Sasa msijali. That is a permission nimeomba mapema. Now, any question thus far? Have we understood how you can make the massage oil?
Yes.
Yes? Oh, we have understood.
Yeah.
Thank you. So you can make an oil or a gel. Kama ile ya Pin by Gone, that is a very powerful arthritis gel. It's a gel. Now, remember, we want to include herbs that are generally regenerating this cells, and also just coming in handy with the nutrients. Tumesema au watu wanataka calcium, wanataka magnesium, wanataka phosphorus, wanataka vitamin E and all that. So you can make your own arthritis formula. Hizi ni formula zingine kali huwezi pata mahali. The first one is a miracle plant called moringa. You can add moringa. And stinging nettle. Stinging nettle should not miss in any of your arthritis formula because stinging nettle is an antihistamine and also an anti-allergen and also an antihistamine, anti-allergen. Or well, it's able to also regenerate the joint matter. How is it called? It's able to regenerate the cartilages. So, stinging nettle, moringa, black cohosh, parsley, slippery elm, alfalfa. Kwanza alfalfa is on a lot of minerals, a lot of minerals, a lot of it. And then blackthorn bark. In my formula, nimeweka moringa, stinging nettle kwa wingi sana. Moringa, stinging nettle ndio mingi sana, then moringa inaifuata kidogo, and then nikaweka slippery elm. Alfalfa pia nimeweka nyingi sana, and then what else did I add? Then parsley pia I didn't include black cohosh because it's a little bit expensive in care. Peppermint will help, but what this other can do? Peppermint. What peppermint can do, the others can also. We are including moringa majorly because it's one of the best herbs that is having a lot of phytochemicals. Then we have blackthorn bark. You can also use that, and chaparrals. Now, I was now to go into specific nutritional support, and I just want to combine both of them. I want you to listen keenly. If you ask me, I will tell you that for arthritis patients, we need to really boost their immunity. And boosting immunity will come handy with increasing blood. Sasa zile salads tunawapatianga, of course, as the first thing, will really help in this. Bora tu mtu amekuwa na alkaline blood and body, so that you do a lot of hydrotherapy yenye inafanya wa sweat, and this is able to release toxins. Number two, you do a detox, and this detox can be a juice detox or just a general detox, blood and organ detox. And with the detox, do not forget, for most of these chronic diseases, do not forget liver kidney detox. We are given a formula the other time. So do not forget liver kidney detox, blood detox, and GIT. Sasa kwa formula yako lazima ikuwe na foods and herbs that are able to alkalize the body, foods and herbs that are able to detox the body, and the specific point of detox inafaa kuwa the liver, the kidney, the blood, and the colon, cleansing, because we all realize that most diseases starts from the colon. And so what happens is that if you're able to write a program that is incorporating all this, then the body will adjust by itself. Alafu kwa hiyo program sasa ndio unaongeza pain relievers, and then now we are coming with anti-arthritis complex. Am I clear up to there before I proceed? Are we together?
Yes.
Yes.
Any question? Well, now, so in the anti-arthritic complex, of course, hata nimewaambia hapa, but let me just go back so that you can see it clearly. You can add, on this list, you can add turmeric. Just add them as I speak so that turmeric is an anti-inflammatory, as you know. So it has idea for pain. Hata moringa is an analgesic and not very much into the inflammation, but an analgesic, a pain reliever. So remember, we're looking for anti-inflammatories, pain relievers, and a group of herbs called immunomodulators. Immunomodulators are able to calm autoimmune. Remember, we talked about rheumatoid arthritis. Sasa hapo you need an autoimmune regulator or immunomodulant. So is the immunomodulant? One of them, by the way, is stinging nettle. One of them is stinging nettle. So there's a herb called Boswellia. Nakujanga tu na extra as an extract. But if you come across this herb, you can even go and research about it. Usikie vile imetumika sana for the same condition. Let me write it in Boswellia. I always have an uncertainty in the sense that naweza funza nimalize, then nakumbuka, oh, I did not mention this, so I need to go back. Acha niongeze hapa Boswellia. Yeah, great. That is the name of the herb. Then nenda polepole ili pia tushike hizi vitu. Tushike hizi vitu. Which herb am I forgetting here? Of course, you can add ginger. You can add ginger there. You can add ginger. We talked about alfalfa. You can add ginger, devil's clay, and cat's clay. And I think that is just enough. That is just enough for me. That is just a good for me. It's just good for me now. 8 and 5 components. If you don't know any this herb, just go and research. Kuna posture up. Then there are arthritis. If you ask me today, I would this would be my combination. Okay, this is my combination. Yangu iko na ginger, iko na turmeric kidogo, iko na stinging nettle nyingi sana, iko na slippery elm, alfalfa nyingi, and then we have nimeka ginger na turmeric na cayenne. How would I forget cayenne? The manner I'm feeling like I am not done with the 4-wheeler and cayenne. Yeah. So I believe that is of help. That is of help. That is of help. That should be help. So just an additional on the same, someone having calcium deficiency must actually be able to improve the vitamin D intake, because vitamin D, by the way, is a very good vitamin that helps in absorption of calcium. Vitamin D helps in absorption of calcium. Sasa mwenye ako na arthritis lazima aende abask kidogo in the sun na kama haiwezi, or for you to actually facilitate the treatment process, just give them the supplement, the vitamin D supplement and the calcium supplement. So that is the first thing. Don't forget that. That is why wanapewa vitamin D. So you can give them vitamin D supplements, vitamin E supplements. Those are antioxidants. Vitamin E ni antioxidant. If you give them vitamin C is very good in immune boosting. So when you boost immunity, the general chances of this patient getting well is actually enhanced. So calcium, vitamin D, and what else? And vitamin K, because vitamin K in a regulate the calcium in the bones. Where is this lecture? So far nimesema about vitamin D, vitamin K, calcium, and of course we are using magnesium sulfate from Epsom salt. And then I was on calcium, by the way. Calcium majorly are found in nuts. Sasa ukizapatia huyo mtu almonds, cashew nuts, pumpkin seeds and flax seeds, and the whole grain, hizo zote ziko na a lot of magnesium hata calcium, and it's actually it will actually do well with them. So nimesema when you have an arthritis, for you to actually get magnesium and calcium, just go for those. And for calcium, include baobab. So there are several alternatives that you can actually with it. And I was just forgetting something on vitamin C. That vitamin C is able to it's a very key requirement in the production of the collagen. Just make sure that you give a lot of green leafy vegetables, and this is what we said. And again, you can give the supplements. I beg to stop there unless there's a question, a burning one, on the treatment of arthritis. And what I've given out, by the way, is just the treatment itself. If you're able to follow every bit of my presentation, then with arthritis, it may take like 4 to 6 months for mtu kupona completely, but during this time there will be no pain if you're able to follow what I've given out. So do we have any questions? Do you have any question? Well, so
I have a question.
yes.
Yeah, there was one time someone had arthritis, and I before I joined some years back, and I had someone say that tamarind is also very good when you make that the drink, then you give the patients in the morning you add some little jaggery. I don't know how true that is for treatment of arthritis.
Great. Someone can actually answer that question. I believe we talked about it yesterday, if I'm not sure. Someone can answer? Well, tamarind, iko na a lot of vitamin C. And hiyo peke yake is able to actually calm the system, but iko na a lot of vitamin C, vitamin E, but majorly vitamin C. And most of the things that have vitamin C are also able to relieve pain. So wanasemanga tamarind is a very good anti-inflammatory and also pain reliever. But majorly to just boost the immunity, and that is the same reason why we use baobab. And there's also one important thing about these bitter things. Most of these bitter things, including fruits and vegetables, they are able to bring about a detoxifying property. So what happens is that tamarind is actually quite bitter. So in regards to this, it's able to detoxify. And what we need to detoxify happen is uric acid. So how does it do this? With a lot of vitamin C, it's actually bringing about a diuretic effect. So the diuretic effect makes it to be a good food for arthritis. But let me be specific on gout arthritis. Gout arthritis ndio tunakuanga na seed mingi. So I believe we are together. That means it will come handy with detox, it will come handy with anti-inflammatory, vitamin C, antioxidant, and also just pain relief.
Okay, sawa.
Okay, thank you. Let me ask you this last question. Don't have something.
Okay, I was asking this like moringa thing, all the ones which you have used. How are they supposed to be used, all of them at once, or?
Tulisema unatengeneza herbal formula for billion, and you just mix all of them, of course in different ratios. But sikuwa nataka kuwapea ratios because nimewapea priorities. I mean, nimewapea priorities in every case. Like the stimulating, nikasema about the anti-inflammatories, kama ginger, nikasema alfalfa, nikaongelea licorice, nikaongelea the slippery, the slippery elm, and all that. My laptop is gone off. Yeah, so you are making a formula. So make the treatment plan, and it should just be at most a 2-page treatment plan for arthritis. I think that should be my exams for this system. Having said all that, I will just invite Kevin to close.